with all these big jet lines, you can get into any country within 24 hours. Is airplane a good place to pick up this virus traveling?
Yes, you can definitely pick up a virus on an airplane because you're spending hours in close proximity to a lot of people. So we know that this virus spreads by large droplets. So basically, anyone within 2 meters of you, you could potentially, if you sneeze or cough on that plane, anyone who's within 2 meters of you, the droplets could land on them. And at the same time, the person who coughed or sneezed could cough and sneeze, and wipe his snot with his hand and then go open the bathroom door in the plane. So there's just a lot of places you could potentially get infected on a plane. It's true.
Okay. Now, my question is, everybody's saying 15 days or 14 days quarantine. Is that sufficient enough to determine this person has it or doesn't have it?
I would say that if the person is going to show symptoms, definitely within 14 days, they would show symptoms. But as we are learning more about this virus, there seems to be a few people who don't show any symptoms. So those people, unless you tested them, you wouldn't know that they have the virus, even after 14 days, because they wouldn't have any symptoms, but actually they're carrying the virus. So quarantine is one way, but given the number of asymptomatic or pre-symptomatic people who carry the virus, testing is the only way to know for sure if they have it or not after the 14 days.
So it's fair to say some people could have it, but it would never bother them, and it doesn't make them sick.
Yes, we don't know what percentage of people don't have any symptoms, but we know that they're there.
Well, how do you explain that?
I don't know, because this is very different from the SARS disease in 2003, which didn't do this at all. SARS only was infectious when you're feeling sick. So it was very clear that, once you're symptomatic, you're infectious. So although this virus is closely related to SARS, the first one, this is a very different behavior that it has, which is probably why it's managed to spread much more quickly and spread much more widely than what SARS did in 2003.
Now, let's talk about you people, healthcare workers who care for people. How you, in a hospital setting, prepare and keep the diseases away from the people who are treating people who are contaminated?
So, of course, even when we're treating a very infectious disease like this, we still have to do our job. But we need the protective equipment to keep ourselves safe. So we have 3 types of protections in medical infection control. One is what we call contact precautions. So this means that how can you prevent getting the virus from touching somebody or touching an object? This is what we call contact prevention. So the best way to prevent contact transmission is wearing gloves in a hospital setting and immediately removing those gloves once you finish the task you're doing and donning a new pair of gloves if you need to do something else. And of course, the number one important thing to prevent contact transmission is washing your hands with soap and water. This is the number one Holy Bible. You must do it. Then there's what we call Droplets Precaution. So this is how do you prevent, the big droplet from someone's cough or from someone's sneeze infecting you. For that, you need some covering that will trap those droplets. So in the hospital setting, depending on the kind of activities you're doing, if you're just a security guard where people are walking past you, then just a surgical mask is enough to protect you. if you're a doctor who's in a consult room where you're sitting very close to someone for quite a long time, then you may need a mask and also some sort of eye protection and a gown. And then if you're doing some procedures like intubating, which means putting a breathing tube down someone's throat, something very invasive where the droplets could just spray everywhere to the point that they almost become like very tiny, what we call aerosols, then you need a different type of mask, what we call an N95 mask, which prevents the transmission of those small aerosols, which are much smaller than droplets. So the kind of protection you need is everybody needs to be washing hands, everybody needs to be wearing gloves, everybody needs to be wearing some mask of some kind, but the type of mask you need is depending on what kind of job you do in the hospital, what kind of procedures you do in the hospital.
Okay. My next question is regarding dead body. In some country in South America, people been throwing out the dead body from coronavirus on the street. Is a dead body a potential transmitter to others?
Yes. In fact, a dead body can be the most infectious of the infectious agents. So we're always very careful to bury bodies in the correct way so as to prevent contamination to people who are attending to the burial, and also to prevent contamination to the soil and the ground where the body is buried in. So I think the WHO has a very good guidelines on this for safe, what they call safe and dignified burial. So if you look on the WHO website, you can read about what is a safe and dignified burial. So safe means that the body must be covered in something waterproof that can secure and make sure that there's no bodily fluids that escape from that body bag that the person is placed into. And then the dignified component comes into making sure that the body is buried in a way that respects the local culture and respects the religion of that person who's being buried. So even in an epidemic, we try as much as possible to accommodate to people's cultural preferences and cultural norms of how they bury bodies, just with this extra layer of making sure that there's a secure bag around the person to prevent body fluids coming out. We make sure that the people who are putting the body into the ground are wearing the appropriate protection so that they don't have any body fluids to come onto them. And the people who are attending the funeral, we ask that the funeral size be much smaller than usual and that people maintain the proper distance.
So some countries been buying incinerators in Asia to burn their body. Is that the best way to get rid of the virus?
Well, like I said, when it comes to dead bodies, there's a safe aspect, but there's also a dignified aspect. So if there is a safe option that matches better with the culture, then we should go for that. So let's say here in Singapore, we have a large Muslim community. So for Muslims, it's not culturally appropriate to burn a body or cremate it. Whereas for Chinese Singaporeans, cremation is a normal part of burying your loved one. So if you're trying to keep the community safe, there is a way to bury in a safe way that is also dignified and respects the culture. So if you have that option, I would always pick the option that's more culturally acceptable while maintaining the safety standards.
Right. So, Doctor, you've been a great source of help and coaching about coronavirus today. Sekou Radio listener, this is a very interesting lesson. We are listening to Dr. NIKKI Kitty in Singapore. Singapore is a leading success containing and preventing the population from getting the coronavirus. And my guest today was, again, Dr. NIKKI. Dr. NIKKI, before we end, is any way you can give a general conclusion to our interview today?
Sure. I just want to really thank everybody who has been giving their good wishes to healthcare workers around the world. They really need your support. So I really encourage you to support them as much as possible. We really value when people are rallying, cheering us on, and also to give us the protective equipment we need, and stay at home so that we don't have to have more cases and we can flatten the curve of the epidemic. So, you guys are the superheroes out there in the community. The battle is won in the community, not in the hospital. By the time the case is in the hospital, it's too late already. You want to really prevent this, and it's you guys who are in the front lines in the community. So stay at home, keep the distance, wash your hands, and listen to the advice that you're being given by the experts. Don't follow, the WhatsApp messages and all the emails and fake news. Really take your information from trusted sources and believe that they are really the best, trying to help all of us get out of this.
Thank you so much, Dr. NIKKI Kitty, and we probably may get back to you again because you instructed a lot today, and we want to thank you for coming to Radio Sekou Radio, and thank you for you guys, our listeners today. Make sure you follow her information and directive and coaching advices. Thank you again.
Thank you for having me.